And the temperature. 98.6. Lovely. All right. Okay. So pupils are 4 millimeters bilaterally. Just relax. I'm going to turn on the light here.
Wow. That's really bright.
Okay, did that hurt? Or?
Yeah, it really did.
Okay. Well, I did see your pupil react. We'll go ahead and skip the other kind of pupil reflexes because that's you're so photosensitive. All right. Now, Tricia, if you could just follow this with your eyes to accessory trochlear abducens and ocular motor nerves. Okay. Great. So now if you could just focus on an object against that far wall and then look at the pen light. Great. All right. Now I'm going to hold this eye chart about 14 inches away, and if you could just read the smallest line that you're able to.
Where creativity happens.
Great. So, both eyes exhibit accommodation, are able to move in coordination, and able to read the eye chart at level 2020. All right, now Tricia, I'm going to assess your trigeminal nerve. Okay, just relax, hold still. All right. Could you feel that?
Mm-hmm.
Super. Now, if you could just tell me if this feels like more of a soft, dull pain, or more or sensation, or more of a sharp sensation. Okay.
Soft, dull.
Okay.
Sharp. Soft, dull, sharp.
Okay. Perfect. Patient exhibits corneal reflex and is able to perceive light, touch, and pain. All right. Tricia, I'm going to assess your vestibular cochlear nerve. I'll start by, if you could just tell me if you can hear the ticking of the watch.
Yes.
Okay. No?
Yes.
Okay. Did it sound louder in one ear?
No.
All right. I'm going to go ahead and perform the Weber and the Ryan test with my tuning fork. All right, can you hear that?
Yes.
Okay. Does it sound louder on one side or the other?
No.
Okay. So just tell me when you can not hear the vibration.
I can't hear it.
Can you hear it now?
Yes.
Okay. Same thing on this side.
I don't hear it.
Can you hear it now?
Yes.
Super. All right. All right, now I'm going to assess the facial, glossopharyngeal, and hypoglossal and vagus nerves. So Tricia, if you would just please smile for me. Great. Could you raise your eyebrows? Puff your cheeks. Very great, very good. All right, now if you could briefly close your eyes tightly. Super. Now, try not to shine this in your eyes, but if you could just go ahead and say, ah. Okay. Now, if you would please stick out your tongue. Move side to side. All right. Perfect. All right. Patient is able to perform various facial expressions without difficulty. The client is able to move tongue in different directions. Oh, could you swallow for me? Perfect. Patient is also able to swallow and speak clearly. Gag reflex test is being omitted. All right, so should we assess your accessory nerves? would you please lift your shoulders against my hands? Super. Now you turn and press against this. Okay, this side. Great. All right, client is able to shrug and turn head against resistance. All right, Tricia, I'm going to assess kind of your pronator drift. If you could hold your arms out to your sides and just hold that for a moment. Great. Client doesn't display any pronator drift. Again, if you could hold your arms out to your side and touch your nose with your right index finger, and then your left. Super. Great job. If I could have your right hand. Okay, so what I'm going to ask you to do is fairly quickly just kind of alternate touching the pad of your thumb, the tips of your fingers. Okay, great. Other hand. Super. All right, now if you could just relax, I'm going to just kind of move a few of your joints here. That's very nice, yes. Great. Now, if you could hold on to my hands, just give it a good, give my fingers a good squeeze. Super. Now, you go ahead and push against my hand. Okay, other direction. Great. Up, down. Great. I would go ahead and assess, her legs and ankle as well. Patient displays equal, full, and appropriate motor function, muscle tone, and strength. All right. Now, I'm going to check some of your reflexes. Start with your biceps. You just kind of turn your arm in like that. Great. You reflex all the way over on the other side, didn't you? All right, great. Now repeat that on your other arm. Now I'm going to do the triceps. Okay. And brachioradialis. Okay. Very nice. Now get a patellar reflex. Super. And repeating all of these on both sides. Then doing the Achilles. Great. Oh, this is gonna tickle, and that's okay. All right. Yay. You saw the toe move, right? Yeah, toe move. All right. All the deep tendon reflexes are evident and within normal ranges. All right, Tricia, if you could stand up for me, please. Great. Put your feet together. Perfect. Now, if you could just hold your arms out just a little bit away from your body, close your eyes, and just hold that pose for a second. Great. You can open your eyes. Now, if you could lift one leg, please, and give me just one hop. Okay, alternate for the other leg. Great. Not much balance there, do you?
And a headache.
Good point. All right, so Tricia, if you could just go ahead and walk 20 paces so I can assess your gait. Great. And on your way back, if you could just walk heel to toe like you got pulled over by the police on last Friday night. Super. You can go ahead and have a seat. All right. So Tricia, I don't see anything on the exam that looks too troubling. However, I think you should probably discuss treatment options with your physician for your head pain. If he or she is unable to kind of take care of or address that pain to your satisfaction is probably not the best choice of words, but if he's unable to treat the pain, I might suggest you consult with a neurologist. They are probably the ones that are most experienced and best suited to handle kind of refractory head pain, migraines, things like that. But thanks for coming in. Do you have any other questions?
No.
Great.
Thank you.
Thank you.